Don't let myopia blur the ending. Good afternoon, dear listeners, and welcome to Eyes on the Road, your go-to show for expert eye health insights. Of course, this show is proudly brought to you by Lagos Traffic Radio 96.1 FM. It's still Myopia Awareness Month, and today we'll be dwelling on that very, very important topic that we're talking about all the month, all through the month. We're talking about myopia, but this time we want to talk about myopia and its connection with blindness. Now, a bit of statistics. Did you know that by 2050, half of the world's population it has been, it's expected that they will be myopic. Yes, by 2050, half of the world's population is expected to be myopic. This is quite an alarming statistics. But what's even more worrying is that untreated or poorly managed myopia can actually lead to irreversible blindness due to complications like glaucoma, retinal detachment, and myopic maculopathy. We talked about this last week. But the good news is it is actually preventable. So today we'll be, unraveling how we can tackle myopia head on and, of course, protect your vision. My name is Akan Usen, welcoming you to the show. Now, as the show progresses, of course, we'll be giving you traffic updates. So far, we've discussed myopia, what causes it, from screen time to outdoor activities. We're taking it a notch higher today by connecting the dots between myopia and blindness and why early intervention matters. Yeah, it's all about knowledge, all about prevention, and all about taking action. Our in-house doctor on the show, Dr. Priscilla Imade, is still out on mission work, so to say. She's unavoidably absent today, but we have very, very able hands. So joining me on the show today to do justice to today's topic is none other than Dr. Aruna Rashidat. She is an optometrist from Modern Eye Care Foundation. Welcome, Doctor.
Thank you. Good evening.
Well, so straight away, I'll be passing you the baton. Help us walk through the steps we can use to prevent myopia and blindness. Yes.
All right. Thank you very much, Akan. It's good to be here, and it's good to be on Eyes on the Road. And this month,
you've not been here for a while now. I don't know why you're running away from us.
I've been on the mission field too.
Indeed, missioners.
Okay, so we've spoken quite a lot with regards to myopia.
Yeah.
And of course, it's justifiable because it's very, very, it can be neglected, right? After all, I can see up close, okay? I probably don't even need to see the things that are too far from me. I just focus on things that are very close to me, and then I neglect it. And by neglecting it, it will result in complications, myopia complications, and then it can result to blindness. Myopia and blindness. Okay, so I'll start with two quite interesting stories. Patient A, I'll call that patient KA. So patient A came.
Yes, okay, KA. Because I have A and K in my name, so it's
no,
but it's fine. Please go on.
It's not you. So patient KA at the age of 6-7. Okay. Let me start like this. The parents, of course, they noticed that the child was having some problem with eyes. Okay, one eye. Once the child take picture, you see that one eye has a kind of whitish reflection.
So what's the normal reflection?
And
it's
one
supposed to
eye
be red.
Okay, so possibly there shouldn't be any
reflection.
Yeah.
Okay, but
so it's just be normal. Yeah. So in pictures,
you see red.
Yes, you see red, especially it's just a reflection of the retina. So it probably, sometimes it doesn't mean there's a problem, but it could mean there's a problem like a cancer or retinoblastoma.
Oh, wow.
So let's not digress. That's digressing.
Okay, but every information, no matter how useless,
every information counts. Yes. So true. So if you see a red reflex or a white reflection, you should take that child to the optometrist to carry out an examination. All right.
Okay.
So patient KA, the parent noticed that the child's eye turns outwards. Okay, whenever in any picture she appeared in, the eye turns outward. So the moms were usually very worried. Okay, and she was like, "There's a problem with the child eye," but I think the dad was not really taking it so seriously, and it affected the child's education. It affected her education, because she had siblings which were very smart, but she wasn't doing well academically till she was about entering into the secondary school or college, and the mom now took it upon herself to take her to an optometrist, and the optometrist carried out her examination and found out that she has myopia. Okay, the myopia is as high as -6 with some amount of astigmatism. Okay, so upon putting on the glasses, the lenses, okay, she realized that she could see bright and clear, and she busted out into tears, crying, and was like, "Is this how everywhere is bright and clear? The trees are green, everywhere is colorful?" And the mom too broke down crying, because this is a child that they both thought, oh, she's academically poor,
not knowing that it was
because she couldn't see. So fast forward to 5-6 years after, the child is doing well. I think the myopia just increased with an amount of about -0.5. So currently she's about going to 30, and her vision is stable and doing well. That's patient KA. Now we have patient LA. In the case of patient LA, he noticed that his vision is not very good. Okay, he came into the clinic at the age of 30. So he's done with university, and he wants to get a car. He's gotten a job and he wants to drive, right? So he came into the clinic and realized that he couldn't read beyond, he couldn't even see the first with each eye. Okay, the right eye couldn't see the very bold first letter on the VA chart. The other eye was hand movement and count finger. So we did comprehensive eye test for him. And with his glasses, he could read with the right eye that couldn't see the very first letter. He could read to the 4th line. He couldn't read beyond. He couldn't get to 20/20 vision.
Okay.
Now the other eye, the pressure was very high in that eye.
Okay.
Pressure was close to 30, and the optic nerve affected everything. We now had to try to salvage that eye because it's almost practically gone, and glasses couldn't even help the eye see better. So upon trying to find out, okay, what's the matter, how come, he said he thought his eyes are okay. He felt every person sees the same way.
Okay.
You understand? So, and when he wanted to drive, found out that he couldn't really see some things, so he was not driving very well, so he had to come do an eye test. And that's how we found out that as a result of uncorrected myopia, he had developed glaucoma that has affected the left eye, which we weren't able to make see better. And 5 years down the line, the eye kept getting worse because the glaucoma has really eaten and affected the vision. And that's patient A and patient B. Now, the mother of patient A was able to, do something and help her to see, to have good vision and be better. While patient A, I wouldn't say is a parent neglect or anything at all, but for one reason or the other, he lost an eye and he couldn't see. And that's how myopia can lead to blindness. So when you hear myopia and you hear blindness, or when you hear blindness, a lot of people are scared. And I think a survey was done in Johns Hopkins University, and blindness was placed alongside some very serious medical conditions like Alzheimer's, like cancer, like AIDS, like heart diseases. And people were asked, okay, what's the worst possible disease that you're afraid of, in life? And you will not believe that blindness was the number one. Because blindness was number one, above every other serious disease that you can think of. So going blind is unimaginable. And every Thursday, Dr. Made take out time to try to educate everyone, try to the eye is very important, and everyone listening, don't just hold the knowledge to yourself. I think you should tell your friend or tell a family member or tell someone. Okay, educate them about the eye. And so far in the month of July, we'll be talking about myopia. Myopia means, or in a simpler term, short-sightedness or nearsightedness. So the medical term is myopia. It means things are close. I mean, one of the symptoms is difficulty seeing things at a distance. Okay. So you'll be able to read things that are up closer to you, but things that are far off, you'll be able to see them clearly because your eyes and the brain are not processing the image properly. So you want to move very close to what is far so that you can see it properly, or just ignore it entirely. And it's because the eyeball, the distance between the front part of your eye and the back part of your eye is too long. As a result, you develop myopia.
Okay.
So hence you need glasses or you need contact lenses to correct them. Okay. So I think I mentioned some symptoms like blurry eyesight at far, clear vision at near, squinting your eyes to see. You know, some people, they will squint their eyes so much, you will see the wrinkle all around their eye just because they cannot see clearly. And I will be like, why not just save yourself the stress? Go to an eye clinic.
Is that like a cause of? Does that also cause?
It's one of a symptom. Oh yes. Now by the time you are squinting, all your eye muscles and the facial muscles, you know, you are stressing the eye, or you are stressing the muscle that way alongside the eye. Of course, it will get weak. So the skin around the eye, it's very soft, starts wrinkling. So just avoid that. Do the right thing, do an eye examination, and then get the necessary correction. Okay. So as a result of squinting, also they develop headaches. Okay, and all that. Some people, they have difficulty seeing at night. Okay, I've had some patients come in, I can't drive at night because I can't see the things clearly, or the lights, they dazzle my eyes while I drive and all. Do an eye examination. It will be taken care of. If it's myopia, it will be corrected. Now, another thing associated with myopia is increase in the power of the glasses. Now, for instance, a 6 or a 7-year-old child, okay, comes into an optometric clinic and finds out that he or she has a power of -6. So in myopia, we term it minus, right? Let's not start with -1.
Okay.
Now, in the next 6 months, that child comes for a follow-up examination and finds out that, my glasses is not as bright as it was 6 months ago. Now, we do another refraction and find out that the child needs a -250. That's an increase from -1 to -250. It's like 100% increase. That's called progression. It means the myopia is progressing. Now, it's okay for myopia
what causes that though?
So elongation of the eyeball.
Okay. So
children, as they are growing, with growth, the eyeball can elongate. Right? Sometimes it can be pathological. We have pathological myopia, and then this increase in myopia is known as progressive myopia. So it increases from -1 to -250.
Okay.
In the space of 6 months. It's a concern, it's a red flag, right? Now that child, let's say give or take 1-2 years, it increases again. Now it is progressive, meaning that you need to watch out for it, because a progressive myopia can progress to adulthood, and if it's not controlled, it can lead to quite a whole wide range of complications, and it can lead to vision loss and blindness. So I'll talk about how myopia leads to blindness.
Okay,
but
so before that, let's just quickly take this update and of course remind listeners of how they can connect with us. We'd definitely love to hear from them. We have a report of a broken down breaking down truck, sorry about that, with tire problems at Igondo Phase 2 bus stop. That's inwards Omolade bus stop. The owner has been spotted, working on it frantically, but already has caused a backlog of traffic, which has extended already to Phase 1 at this time. A broken down truck with tire problems at Igondo Phase 2 bus stop in Omolade bus stop. It's causing a backlog of traffic, extending all the way to Phase 1. Do you remember you can connect with us? 091-538-77127. We'd definitely love to hear from you. And WhatsApp is also a way to connect with us. 080-991-20777. Sixtus says, okay, good evening. How's your day, man? What's good? Greetings from this side. Thank you, Sixtus from Abulegba. Mrs. Adedo says, Dr. Aruna, how are you? Nice to hear your lecture. We appreciate you. Mrs. Adedo Neo. She's saying hello. And this is Bobby J. Bobby J says, good evening. Is it possible to correct eye vision? And how do I know I have myopia? This is Bobby J. Bobby J wants to know. So can we just touch on that? 080-991-20777. That's the WhatsApp line. You can also call 091-538-77127. We have a call from Elder Tewagbade. Can we just quickly take that, and then we continue with the rest of the show? Let's take that real quick. Hello, Elder.
Good evening, ma.
Good evening, sir. Good evening, Elder Tewagbade. I'm fine. How are you, sir? It's good to hear your voice.
Quite a long time.
Yes, sir. It is. It is.
I just want to ask, this issue of myopia, is it blood-related something?
Is it what?
Blood-related.
Okay, you mean can it be inherited?
One.
Okay, sir.
Then can we treat it through blood? Like using tablets.
Okay.
You get my point?
Not really.
Okay. If it can be treated using drugs, if it can be treated.
Okay, can it be treated using drugs? Is that the question, sir?
Either drug or tablet.
Okay.
Thank you very much, Elder, for the question.
Thank you,
Doctor.
All right.
So let's just touch on all this.
I'll touch on everything. So
yes.
I thank you, Mrs. Idowu, for the shout out, right? And then the other guy, Bobby J, asked,
is it possible to correct eye vision? How do I know I have myopia?
Okay, so yes,
that's like
it's possible.
Symptoms of myopia.
Yes.
What would you notice?
So you have blurry sight.
Blurry vision. Okay.
Blurry vision, especially at distance. That's the most. So you
can
common.
see things around you, things
yes,
close,
things are close.
Things are far. You start squinting.
Yes, you squint.
Okay.
If you want to read, you can read. You have no issues reading. But when you want to look at it, watch a TV or look at a signpost or drive or look at things that are far off, you won't be able to. And myopia is in degrees. Okay, we have minus 050, you have minus 1, you have minus 2. In fact, we have as high as minus 20, minus 23. Such power is so high that you'll not even be able to see your hand or the front of your face. So once you notice that things are far, it's blurry, then it's a very key sign in myopia.
Okay.
Yes, so you should go. You can treat it, or you can find out you have myopia by going for an eye examination.
Okay,
right?
He says I can't read but can see from afar.
Oh, you can't read, but okay, so it depends on your age, right?
So that should be something else.
So it should be either you're having hyperopia, astigmatism, or presbyopia.
Presbyopia.
Right? Yes. So
or old eye, as you.
yes, presbyopia, old eye.
Okay.
Yeah. So you need to go for an eye exam. If you don't carry out an eye examination, you won't know what it is, please. So you should go for an eye examination. Then, Elder Tewagbade, this question. Thank you for your question, sir. So myopia can be inherited, of course. And I think we spoke about it last week, where we made mention of the fact that if a parent has myopia, one of the parents, right, it's the chances of the child getting it is about 7% or so. And then when both parents, if none of the parents have it, the chances is like 7%. Okay. Now, if both parents have, one of the parents have myopia, the chances increases by twice, like 14%. Okay. Now, when both parents have it, the chances increase by over 50%.
So it's geometric progression.
Yes, it is. So it can be passed on. Then medications is not the treatment for myopia. Okay. Lenses, glasses, contact lenses, and we have a variety. In fact, surgery as well. We have LASIK surgery that can correct the curvature of the cornea, and then you don't have to wear glasses. If you don't want to do surgery, we have contact lenses. If you don't want to wear contact lenses, we have spectacle lenses, which is glasses. So there's a wide range of correction or management for myopia. So just visit your optometrist and discuss any of the options that you would want. Okay, I think I've answered all the questions. I'm going to talk about the global trend. So it's estimated that in the year 2050, 50% of the world's population will be myopic. So it's becoming, right now it is at an epidemic level. Probably by then it will be a pandemic like COVID, right? So everyone needs to watch out. Everyone needs to take measures, and that's what we've been discussing all throughout last week and last 2 weeks. So especially among children and young adults. So you out there, take all your family. People should go for an eye examination. Just rule out the fact that you do not have myopia or you do not have any other eye problem that could affect your vision or lead to blindness. Now, how can myopia lead to blindness? Myopia can cause glaucoma. That's probably not number one, but that one is irreversible in the sense that once you have glaucoma, and it has advanced, vision loss is irreversible. So you don't want to lose your sight with something you can actually avoid by wearing your glasses or doing an eye examination. So go for an eye examination. Then another cause or another way myopia can lead to blindness is myopic maculopathy. Okay. So as a result of the stretching of the eyeball, as a result of elongation, we have the retina, which is at the back of the eye, that's connected with the brain, right? Once the eyeball is elongating, the retina stretches.
Okay. And can we take this call real quick? Hello.
Hello.
Yes. Good afternoon. Your name and location, please.
Yeah, this is Otumba Rotimi from Ikorodu.
Okay, Otumba Rotimi from Ikorodu. Great to have you with us. Please go on.
Yeah, my question is that somebody has asked that question, but I want the clarity.
Okay.
Myopic is one that can see the object that is close.
Yes.
And you cannot see the one that is far.
Yes.
Now, what of the person? And that one, as you said, it can lead to blindness if care is not taken.
Yes.
Now, what if somebody cannot read either from book very well, clearly, or phone, or whatever, and he can see afar without glasses? But why with glasses? Like me, I can read very well while I'm with my glasses. But if I'm not with my glasses, I need to be stressing the eyes before I can read. And if I take longer time, I'll be feeling pain. So as if it's ordered to cause like headache or whatever, but I can see afar without glasses or anything.
Okay.
What causes that, and what are the remedies?
Okay, thank you very much, Otumba Rotimi.
Thank you.
All right.
Thank you for that question. Yes. So
it's still taking us back to
for most of
but
the
what
cases,
you described, this should be presbyopia.
Presbyopia, yes, presbyopia. So presbyopia happens when you get to the age of 40 and above, as you get older. So tiny things are difficult. You need glasses to read. All right. So there are other things that can cause it, but most of the time it's presbyopia.
So we have a question here on WhatsApp. Doctor, we might have to, have a second installment of this.
This month is okay. Anyway, maybe by next week, during the question and answer time, everyone can
wrap everything
open
up.
day. Yes.
So good evening, all. Please, can I get a drop to correct my sight and later get eye drop before the end of the year, because an optician prescribed a medication for me years before, but I've not gotten it because I can't remember. I can't see from afar. This is Koforola. Okay. Do you understand the message?
She needs an eye
drop to correct her sight. Later, she got an eye drop before the end of the year. Okay, so maybe this person just has to probably.
Yes, you should go and see your optometrist. Find time. Okay, most of the time when people come to the clinic, it's already too late, and I'll be like, where were you when it started? Sometimes I wonder because most eye problem, they go gradually. Before it happens suddenly, it's an emergency, so it happens gradually. So when it was still beginning, where were you? Why didn't you come at that time? Why did you wait till it's too late? So avoid waiting till it's too late. Once you notice any symptoms or sign, just go straight. We have so many eye clinics in the whole of the Nigeria. So find one that's close to you, right? Modern Eye Clinic is there too.
So I actually lost glasses. That's what she said.
She lost her glasses.
Yes.
So go to your optometrist. You made the glasses somewhere, right?
Mm-hmm.
So go back to that place, and if you are not there, find somewhere close by. And not an optician, optometrist. Go to a proper eye doctor. Going to optician is not going to help you in any way. Go to an optometrist to do a proper comprehensive eye test for you. They'll tell you, in fact, if you have a problem that's going to come on in the next 2, 3, 5 years or later on, you'll be told. These are why people do comprehensive eye test, okay? All right. So moving on. Myopia can cause cataracts. Now, because the eyeball is long, okay, there's a theory that says that enough nutrients or vitamins doesn't go to the lens, which is the posterior part of the eye, and it can cause posterior subcapsular cataract. So that's one of the way it can lead to blindness. But easily you can operate on cataract, and an intraocular lens will be placed in your eye, and you can see clearly again. Now, it can lead to, I was explaining retinal detachment before the call. As a result of the elongation or the stretching of the retina, okay, it can there can be a tear, and it can detach from the back part of the eye. Now, depending on where the tear or the detachment takes place, it can be fixed, okay? Or if it happens on the center part of the eye, which is the macular area, vision loss can take place. So in order to avoid this, you need to go for an eye examination. And there's a now with advancement of technology, we have new better method of managing myopia. What you need to do is see your optometrist, right? See your optometrist. There are other complications, like I think I talked about myopic maculopathy.
Yes.
So one can have strabismus, one can have amblyopia, one can have vitreous hemorrhage or choroidal detachment and all. These are all complications of, in fact, there is staphyloma, which is a stretching of the retina, or when you say oma, you're even talking of a cancer, sort of. So that can cause myopia.
We might have to just see how we can wrap things up at this time. But like every other thing that has to, we'll just take it into next week. Next week is open week, open day. So, dear listeners, of course, you can call in. You can call in, you can send your questions, send everything you want to find out about, all about myopia. We'll definitely, touch on everything and anything, myopia, blindness, and every other thing in between. Thank you so much. Thank you so much, Dr. Rashidat Aruna. It's been an amazing time with you on the show. It's been an eye-opening one. So far, dear listener, we've discussed myopia and its causes, from screen time to outdoor activities. And now we took it a step further. We've just connected the dots. Blindness from myopia is avoidable, and that's what we've been able to establish. So start with awareness, continue with the action, and remember that early detection and the right care can change the story. You can go to our Facebook page, our YouTube channel. Lagos Traffic Radio 96.1 FM. That's our Facebook page, Traffic Radio 961, and you can just catch up on the show. Dr. Priscilla Imade, OD, MSc, PhD in Public Health, a consultant optometrist at Modern Eye Care Foundation, and a fellow of both the American Academy of Optometry and the Nigerian Optometrists Association. If you want to reach out to the team at Modern Eye Care Foundation, you can call 080-3333-6672. And you can reach them. The hospital is plot 16 to 18, Ogunusi Road, opposite Omoli Estate, Phase 1 by Akyode, bus stop Ojodu Berger, Lagos. On behalf of the production team led by Micah Arocha, with assistance from Adilike Toluwalashe and the rest of the interns. What's your name? Okay. Ibrahim Arike. And of course, not forgetting our executive producer, Tayo Koni. My name is Akan Usen. See you next week. Eyes on the road, your safety, our priority. Lagos Traffic Radio.